This is Dr. Rajni Mandal with Pathology Watch, here with your 3D 3-minute digital dermatopathology digest. Today's topic is seborrheic keratosis. Seborrheic keratosis is a benign epidermal tumor with common histological features of acanthosis, meaning widening and thickening of the epidermis, papillomatosis, meaning a rounded contour of the epidermis, sometimes forming finger-like projections, and horn pseudocysts. This is due to invagination of the epidermis, forming a cyst-like space that is filled with basket weave keratin. There are multiple histological types of seborrheic keratosis. This is the acanthotic variant due to the widening and the thickening of the epidermis. Here you see the reticulated variant of seborrheic keratosis, characterized by proliferation of keratinocytes that form a lattice or net-like network here in the dermis. This is the pigmented form of seborrheic keratosis due to increased melanin granules in the cytoplasm of the epidermal cells. Seborrheic keratosis is due to proliferation of keratinocytes. These keratinocytes have ample cytoplasm and very small nuclei with rounded, smooth nuclear contours and a homogeneous chromatin pattern. Another histological variant of seborrheic keratosis is the clonal variant. Here you see the common features of acanthosis, slight papillomatosis, as well as keratin pseudocysts. There is a proliferation of cells that form islands within the seborrheic keratoses. These cells have decreased cytoplasm, but still have small nuclei with smooth nuclear contours and a homogeneous chromatin pattern. These are the clonal nests in a clonal seborrheic keratosis. Seborrheic keratoses can also become irritated, forming squamous eddies, and inflamed, such as in this case, where there are increased inflammatory cells in the dermis. Here there are lymphocytes. These lymphocytes can also extend within the lesion where there can be spongiosis. So here are today your 5 flashbacks or important things to remember about seborrheic keratosis. This is a benign epidermal tumor with common histological features of acanthosis, papillomatosis, and horn pseudocysts. There are multiple histological types, such as acanthotic, reticulated, and clonal. They can become irritated and form squamous eddies and inflamed, which can lead to spongiosis and inflammation. The lesser Trellat sign is important to remember, and this is when there are increased seborrheic keratoses, usually in the trunk area, associated with early onset of visceral malignancy, and sometimes lymphoproliferative disorders. Seborrheic keratoses can be histologically identical to epidermal nevi, and therefore clinical information about age of the patient is crucial to make the diagnosis. That's it from me. This is Dr. Rajni Mandal from Pathology Watch, revolutionizing pathology for dermatologists. Visit us at pathologywatch.com.